Good afternoon, everyone. Welcome to our Wednesday CEO Desktop Chat. Thank you for joining us. I'm Terry Lightfoot, Director of Public Affairs and Community Engagement here at Alameda Health System. We're looking forward to hearing your questions and providing some feedback and responses. We'll have start off with CEO Delvecchio Finley provide some comments, but before we turn it over to him, if we can have other members of the panel introduce themselves, we'll get started. And why don't I start with our on-the-ground intrepid correspondent in our newly opened testing center, Felicia.
Sure. Hi, this is Felicia Tornabene, the Associate Chief Medical Officer, coming to you live from the Highland HCP P2 garage, where our new testing site is going to start in 1 hour.
Woohoo!
And this is Janet, the Chief Nurse Executive, Chief Administrative Officer for the acute care.
This is Rachel Baden, Chair of Medicine at Alameda Health System and Infectious Disease Specialist.
And this is Tony Redmond, Chief Human Resources Officer.
Great. Terry, you've already introduced yourself. Good afternoon, everyone. Thanks as always for all of you who have taken time out of your busy schedule to join us on this week's Desktop Chat. As you know, we've been steadily sharing or continuing to share information around our COVID-19 preparedness efforts, what's going on in our community, and our own restoration efforts, but also balancing that with using this tool, which is proven, at least from your engagement, to be an effective way to communicate other things going on in our organization, and we want to continue to do that as long as that works for you. So today I will be providing you with updates on our restoration efforts and answer questions you may have along with my wonderful panel here. But first, obviously, given what is going on in our communities, I want to make a few comments. It's been a very difficult week for all of us, and we are saddened by the ongoing violence and increasing instances of hate, of fear, of racism that we see in our country, and especially for our communities of color. I hope that many of you got a chance to read the memo that I sent out yesterday. And while I don't want to repeat myself, I do want to reiterate that the challenge of racial prejudice outside of our organization only serves to remind us of the requirement of internal vigilance to ensure that our thoughts and our actions always affirm value and dignity to everyone in our organization and in our community. During these trying times, we must continue to remain focused on our mission of caring, healing, teaching, and serving all. I ask that we all stay strong and we continue to work together to support one another. Our commitment to health equity, diversity, and inclusion will not waver. And in fact, instances like this fuel that work, fuel the importance of that work, and move us towards true change. So I'm going to talk a little bit, as I mentioned, on our restoration efforts. I'm going to talk about testing just a little bit, and we'll celebrate again our launching of our new site here at Highland. Talk about survey readiness, and then be open for your questions and answers. But as I always like to do before I even get into that, I want to particularly put emphasis on some good news and shout outs that I want to give first. But at the same time, while I do this and provide updates, you all always ask such amazing and insightful questions, and we look forward to hearing them. I'm going to ask you to also do an additional thing this week. I'm going to share some good news just as I've been apprised of it, but I'll ask that you do the same thing. Let's take the opportunity to lift one another up. There's so much going on that's wonderful in our organization and in our communities that I think that we can take some moments interspersed between our Q&A today to share that good news that may only be in certain parts of or known in certain parts of the organization, and we can lift it up today. So with that in mind, I want to start with celebrating our graduates across the organization, our own residents. We have amazing residency programs in internal medicine and emergency emergency medicine. We have surgical residents in East Bay Group, and a couple of other medical students and others who work throughout our organization. We work with students in various programs in clinical parts of the organization. We have our own students in Health Path and our own Health Path programs who are in high school and in college and other parts of their academic journey who are also graduating. So I want to do my tip of the hat, the cap as it is, cap and gown to all of you to celebrate you. And finally, actually your own children or relatives. I know many of you, your neighbors, your kids are all experiencing this this momentous occasion a lot differently than they otherwise would. So let's pile on all the praise and the congratulations as we can. And I want to be sure to extend mine to all of you as well. This month is also Pride Month, and so annually this year across the country, across the world, we celebrate the diversity of our community, and we celebrate and lift up our members of our LGBTQ community and population, and we don't want to miss that opportunity in the midst of all of this to lift to do the same thing. It's just one moment out of a year when we should always celebrate our diversity, but I want to do that as well in this moment. I want to give a shout out to our surgeons. Many of you may know that we've been gradually expanding the level of so quaternary types of surgical interventions that we can do in our organization and support our community. And earlier this month, we celebrated an additional I think it's a sort of TAVR type surgery, a transaortic valve replacement, I believe it was, and I probably completely botched that. So apologies, Dr. Victorino, if you hear this, but someone will correct me, I'm sure. But I really want to celebrate the continued progress in that respect. Specific to COVID-19, our own Dr. Baden, who's on the call, has brought to the organization a clinical trial. I think we mentioned this a couple of months ago, but I believe, and Rachel will correct me, we've had our first a patient enrolled in that study. Is that right, Dr. Baden? Great. So I want to lift that up, and we can share a bit more about that in the Q&A if there's interest. But want to lift that up. We found out today that our addiction medicine grant, it's a partnership with UCSF under the leadership of Dr. David Tien, has received a notice of award, a very high score, and really appreciate and support his efforts to expand the work that we're doing in our behavioral health and substance abuse work in the ambulatory setting with others like Dr. Karen Wise and Dr. Barbaria and our other behavioral health or our behavioral health specialists. Our contracts and grants team, a lot of these grant efforts are supported by an amazing team, a small but mighty team under our Garvey Golden, and I really want to lift up Garvey and celebrate the work that he is doing too. And then lastly, I want to really say a really special thanks to our trauma team, particularly in this past week, getting a little emotional here. Things have been really tough in our community, and we're a level 1 trauma center, and we don't take that commitment to our community lightly. And I know the toll beginning Friday that's had on a lot of our folks in our emergency room, operating room, ICU, and others, and more importantly, the members of our community who have been adversely impacted by a lot of these things. And so I really want to say thank you and give a shout out to all of you for really showing up always, but especially during this time. So thank you. That's enough for shout outs for now. I'm losing it a little bit anyway, so I should stop. I'm going to move on to talking about restoration efforts and testing. So restoration, just want to give an update. Our oversight committee continues to review plans, and really want to thank those leaders in our various areas who are looking at bringing back various levels of elective procedures and services to our community. The need is definitely there, and we want to be here to support you. Restoration or reopening of services is critical, and it's important that we follow a process, though, that is provides us with an opportunity to address gaps that we have had, to improve performance in a variety of efforts and ways, including throughput, block scheduling, patient experience, resource utilization, and staffing. So if you're looking at our COVID-19 numbers across the county, you've noticed that in the last week or so, our numbers continue to rise. They're not plateauing. The number of positive cases in our community as a result of community spread and enhanced testing are going up. And in fact, Alameda County has the highest number of cases in the Bay Area right now. We've also seen a growth in cases, or at least a slight growth in cases in our inpatient setting. A little bit of a plateau, and we're pleased for that, but the numbers are still significant enough that we can't take our eye off the ball here. As I've mentioned previously, we've taken a very systematic approach to restoring services, and we're proud of that. It's been much slower than some would like, and many are rightfully concerned about the pace with which we're bringing it back. But we are really trying to exercise an abundance of caution and make sure that we're looking at all these factors, including what's happening in our community, what we're experiencing in our organization in terms of cases, the severity of those cases, personal protective equipment, and our ability to rely on the supply chain to do that, and staffing and a number of other factors. Having sufficient PPE and supplies is crucial in our efforts to restore services, and hospitals nationwide are looking at that as they begin to ramp up delayed services as well. The acquisition of supplies will be an ongoing challenge. Unfortunately, the supply chains continue to be strained. We're still on what's referred to as allocation, so we're not getting all of what we're requesting because there still is a scarcity in our market and in our country. But we're working very closely to source as best we can, and to make sure that as we ramp up services, we avoid as best we can disruptions in services and or impacts to quality or safety. So more to come on that respect. The latest supply dashboard, as we shared with you last week, is being posted on our intranet every Tuesday now. It's updated, similar to last week. And if you go onto the website, you'll see that we continue to experience a limited supply of both procedural and isolation gowns, which are important for many of our services that we are restoring. As of now, we have only granted approval for our operating areas, our perioperative sites at all three acute campuses to restore services, and there's still preparatory work underway to make sure that that can happen seamlessly and safely. I'll turn now to testing. I'm pleased to announce, and you just heard earlier, that we, this afternoon in about an hour, we'll be opening up another drive-up, walk-up site for COVID-19 testing located here on our Highland campus on the top level of the HCP parking garage. AHS patients who meet certain criteria can now receive their tests at either the San Leandro Hospital site and now also at the Highland Hospital site, with AHS doctors across our system with the ability to order irrespective of which site campus our patients may be getting their primary care or other services. This expanded access to testing is critical and crucial for our ability to safely restore services, as I was mentioning earlier. And just briefly, a really sincere thank you to Dr. Turnabene, Dr. Gupta, Dr. Ng, and staff in patient access, facilities, and nursing for all your hard work to continue to expand our efforts, with I know more to come. I'll turn and share just a brief bit about survey readiness. As you all are aware, our window for a possible Joint Commission resurvey has opened. The Joint Commission has commenced their live surveying visit activities as of June 1st. We're expecting them to come back, and I want to say a tremendous and hearty thank you to all of you. We have made outstanding progress, but we must maintain focus on this effort and be prepared to demonstrate a heightened readiness and commitment to our quality care and exceptional patient experience. I want to underscore at this point too, and many of our leaders have said this, our clinical and administrative leaders, that this is not just about getting ready for a survey, and I don't want people to walk away or ever take that impression. This is about continued readiness to ensure that we are always delivering the highest quality care for our patients. So let me be sure to share that with you. I would like to recommend that you are, particularly now, noticing any issues that you continue to observe and or struggle with, raise a flag, raise your hand, reach out to your immediate managers or other leaders in the organization. Feel free to reach out to me and others, and we will help. We want to make sure that we're all looking out for one another, looking out for the organization, looking out for the people we serve. I want to thank a lot of the clinical and administrative leaders who are doing a great amount of rounding. We've increased our roundings. Someone asked about that last week, and I really appreciate the question. Some of you encountered me fairly late here Sunday night and early Monday morning, and I know people have been doing the same thing at other sites, and so I really want to thank you for doing that. Implore you to do it more. Talk to staff. I had amazing conversations with a lot of our staff, just acknowledging their great work, but also pointing out areas where we still can support them and where they can continue to support one another. I also want to acknowledge some of our clinical leaders, particularly leaders in diagnostic imaging, in quality, in nursing, in perioperative areas. We had a particular issue last week. It involved stopping the line for a procedure that we offer to ensure that we are very comfortable with the level of safety that we're providing there. I know there's still a little bit of work to do in that space, but really want to appreciate everyone coming together and really prioritizing quality and safety in our organization, both for our patients and the members of the team. So with that, I'll pause and we will go to the Q&A. Hopefully you've had a time to think through some of those wonderful questions you always ask and share a bit of good news as well. So with that, Terry, I'll turn it over to you.
Great, thank you, Delvecchio. Appreciate your comments. Just a reminder, if you have questions, there is a Q&A icon at the bottom of your screen. Click on that, type in your questions, and we will try to get to as many of them as we can during our conversation today. I'm going to take a little bit of license and go back to Dr. Tornabene. What are the hours and days of operation of the testing center?
So for the Highland site, it is 1 p.m. to 5 p.m. on weekdays. At the San Leandro site, we maintain the 10 a.m. to 2 p.m. And the route, as Delvecchio was saying in his introduction, is that a patient would be referred by an AHS physician and an order would be placed. And there was expanded criteria that went out through some ambulatory provider listserv last Friday in order to expand our testing criteria to asymptomatic individuals who are household contacts, and then certainly at the discretion of the clinician for further testing.
Great. All right. Thank you. Dr. Baden, we'd love to get these really tough questions around testing and vaccines when you're on the line. So thank you for being here. I have two. The first one is, how far are we from a COVID-19 vaccine? In addition to that, I'm wondering if you could talk a little bit about our utilization of remdesivir here within our system.
Yeah, great questions. Thank you for that. So regarding the COVID-19 vaccine, I wish I had a crystal ball to really say when we'll have a vaccine that's available. I do know that some of the front runners for the vaccines that are in development are heading into phase 3 of their clinical trials, probably sometime in the next month or two. So that's the final stage before approval is sought by the FDA usually. There was a lot of press in the last 24 or 48 hours saying that maybe by early 2021 that we may have some vaccines that are available broadly for the US population and beyond. But I really can't say. It's not clear yet. There's not clear data on how well the vaccines are performing and when we can expect them to be available. But I hope as soon as possible. And I think early 2021 is a realistic expectation based on the data that we do have.
Okay. And remdesivir?
Yes, remdesivir. So just to bring everybody up to speed, I'm sorry I haven't been able to participate in our CEO chats for the last few weeks, but remdesivir is an antiviral that was initially studied with other viruses such as Ebola and was found to have some activity against COVID-19, and the early clinical trial data supports that it may offer mortality benefit and also decreased durations of symptoms and hospitalization. Gilead, the manufacturer that makes this drug, made their supply available to our federal government some weeks ago. And since then, our federal government has been dispensing the supply of remdesivir across the country. And we did have some doses that were made available to us here in our county. So Alameda County has been dispensing remdesivir based on need to hospitals across our country for the last few weeks. And we have successfully dosed about 15 patients so far. And we're in continuous communication with the county based on our need and their allotment. Today, they requested our data once again because there's another federal allotment that's come in as of last night. And so we may even receive more doses. I can say confidently that all the patients that have qualified since these doses were made available based on the criteria that was set forth from clinical trials and then also strict criteria from our county, that all the patients here at AHS who qualified for remdesivir have received remdesivir. So that's been really gratifying and super positive to be able to offer some therapeutic to these very sick patients. So that's really good news. And we'll continue to collaborate with the county and provide them with the data they need so they can continue to provide us with this remdesivir as long as it's available to us.
So Terry, before you move on, I want to welcome you back, Dr. Baden. We have missed you. We've seen it in some of the comments too, so it's not just us. But also, you won't say this, but I think it's important for people to know you've been our leader in actually advocating for access for remdesivir and facilitating the process by which we get it, and that's been is incredibly helpful. So thank you for that as well.
Thank you. It's really important to me, and this is central to our mission, that our patients have access to those therapeutics, so they have access to the same therapeutics that patients elsewhere have. So this is at the core of who we are at AHS, and certainly this is one of the most important things we can be doing right now for these patients.
Great, thank you so much. Janet, in part of our restoration activity, I know we've been receiving plans from various groups. There's a question about restoration of surgery and operational procedures. Can you give us an update on where we are currently with that process?
Yeah, so I think Del Vecchio alluded to it a little bit, but we have, we call it the ROC Committee, or it's the Restoration Operation Committee. There are some very robust plans that went out to each service line, and really to make sure that we covered all the bases in terms of PPE. How do we get the right kits back in from our suppliers? How do we make sure that we've got staff to do surgeries? How do we ensure that we can do testing? So those were sent out to the teams. The peri-op department came back with a very robust product, and the green light was given. Having said that, though, it's predicated on a number of things. And so, you know, we had a number of traumas last weekend. Traumas certainly take a priority for us. We are a level 1 trauma center at Highland, and we need to make sure that we can continue to serve the public in those needs. PPE was another issue. We want to make sure that we don't ramp up surgery so fast that we go through our entire PPE supply. How do we make sure that we have comprehensive testing for patients to make sure that you know, they come in and that we're confident that they do not have COVID-19 coming into the OR setting. So we will start slowly and ramp up services at all sites. There is kind of a metric where we are, you know, at a 25%, 50%, 75%. It is a longish timeline. And so I think stage 3 was not even projected to get to that until September or October. So we will certainly watch as we start to ramp up surgeries that we're making a concerted effort to make sure that we're monitoring our PPE use. We certainly don't want to go through a week and then go, whoa, we ran out of PPE and we've got people booked for surgeries, and then we have a heavy trauma weekend and we don't have our necessary gear for people. So all that to say, it is on the radar. The intent is to start to open services. We have always been open for emergency surgeries. Certainly traumas, none of that has changed. It's adding the elective surgeries in addition to that and making sure that we have everything in place so we can safely do that, both for our patients, but for our staff as well. So hopefully that answered the question.
Great. Great answer. Thank you. Now, as we are testing or expanding testing for patients, there's a number of questions about what might we be doing in the future in terms of expanding testing to employees and staff on a regular basis. Any thoughts on where we are in that regard that we may be concerned?
Yeah, I'm happy to start that, responding to that question. So right now we are working on a process to do monthly testing of all of the post-acute staff. I know that Terry Dixon, Employee Health, and Dr. Dee Ghosh they've been leading the charge with Richard Espinoza on standing up that testing program. I was just speaking with Dr. Baden before this call that we want to take a look again at what we need to do in terms of further expansion of testing, whether there's a need to look at regular surveillance testing in other areas as well. So certainly it is an active area of discussion right now. So these questions are all on point. And so right now, starting in the post-acute, and then we'll keep looking from there.
Felicia, can you share a bit more about kind of the progression of our testing capabilities too, and what we're expecting? I think we've shared it before, but I think that will also sort of influence our ability to provide robust and timely testing and results as well. Maybe that'll be helpful for people to hear.
Sure, sure. We've been, as our testing team, we have a number of us that work together, and we've been proceeding through a series of phases where we first started with our patients that are symptomatic, as well as our employees that are symptomatic. And we have different testing strategies for both. One for our patients that was at the San Leandro site, and for our employees, it was at the Highland Urgent Care Center. And then as we have moved on in this pandemic, we've been working on expanding the testing to, as I was mentioning briefly earlier, is to asymptomatic patients seen in our ambulatory setting or in a video or telephonic visit who might be high risk, and that's at the discretion and guidance of the provider who would place that order. We are also looking at doing some testing at John George for purposes of discharge planning, and hope at some point to do surveillance testing in that environment more broadly once we can have a more rapid turnaround time in terms of the test. And then excitingly, we're looking at connecting with the county and certainly some cities, and maybe partnering in either helping link patients to care to AHS, or even collaborating on testing sites. Just this morning, I want to give a shout out to to Dr. Epen and Michelle Benaisa at the Newark Wellness Center. They were fantastic and hosted me this morning. It's a lovely clinic and wellness center down there. As we're looking to possibly partner with the county on a community testing site at the Newark Wellness Center. Of course, there's lots of questions and logistics and whatnot that we would need to work out, but I so appreciate the collaboration and interest from the leaders down there. As we move forward, of course, there's the question about how we continue expanding. Testing is here to stay. We need to have a program, and we need to continuously reassess and expand our who we test and our capacity.
Thank you, thank you. And then correct me if I'm wrong, I believe Dr. Hing affirmed for us again yesterday that in terms of our ability to do more of the testing in-house, that we're still on pace to get that in a couple of weeks here.
Yep. We should be able to bring the RT-PCR testing in-house to the Highland lab in about a month. By the end of June, we should have that, and that should help with a fast turnaround time that should be certainly less than 24 hours, even sooner sometimes.
That's great. Thank you.
Mm-hmm.
Hey, Tony, this is Terry, or you know who I am. I wasn't seeing your picture though, so I was on the phone. My apologies. Anyway, there's some questions about, as schools are starting to ramp up, there's a lot of uncertainty about how those things may factor into impacting our staff. We know you mentioned in the last call that we were doing some work around looking at our work from home policy. Any update on where we are there and how we may be factoring these issues into that process?
Yeah, so I got a final report yesterday on the positions that, from a managerial standpoint, we consider can work remotely. And what we're looking at is those that can work remotely some of the time, and those that can work remotely likely all of the time. We're working through the issues that I mentioned last time, which are ergonomics, because people are at home working in situations that are not the same as the office. Workers' comp, again, those are just things that we have to resolve. I don't see them as barriers. We'll be providing this list to the Restoration Committee so they can look through it, and with considerations about how we address the future state. I don't think the future state is what our past state is. I don't expect us in totality to ever go back to the way it was with everyone working in the office all the time. And so what we're looking at is ways to be flexible where we can be flexible. What we will need to develop are measurements and metrics on work performance. Those should have always been in the place, but I think this pushes us, just like our ability to provide telemedicine, we need to measure how the work is getting done. Can people resolve it at home? Do they need to come into the office? And if they're going to work from home, what do we need to provide them so they can be successful? So these are items we're working our way through. It's not a simple task, and there's a lot of assessment to be done. We will be providing all the leaders who have people working remotely a questionnaire coming out. It'll be in the form of a Survey Monkey with a set of criteria to talk us through how this has worked for them. The same will be done for the employees that have been working remotely, so we can hear from them both what has worked for them, what has been a challenge, and what they feel they need to be successful if this was to continue. So we're getting the holistic picture from the employees who are doing the work, their sense of their productivity, and both the manager's side of that, so we can understand what we need to do to move this forward. So it's going to be ongoing. We understand that the schools are unclear. My kids are in Alameda, and they're really very unclear about what's going to happen. There are options that they're going to work kids into school every other week or every third week to keep social distancing. Some of the schools are talking about entirely social distancing and alternatives along those two ends of a continuum. So it's unclear for everyone what's going to happen. We're looking at the ways we can accommodate our employees the best that we can.
Right. Thank you so much. Jen, I want you to give us a little, Delvecchio encouraged us to raise a flag on some really good opportunities and issues that have come across. I understand we had a centenarian who was here at our facility suffering with COVID-19. And can you give us an update on her status and some of the work that went into treating her?
Yeah, so just to start with a shout out to everyone involved in this individual's care. So this was a 100-year-old woman who came in, had not been outside, had not been in contact with anybody for a number of months. She has her own little garden that she picks around. She lives with her daughter. She came in, started on not in the ICU. The daughter actually waited in her car for about 6 hours, and Teresa and I connected and allowed the daughter to come up. This person is from a little village in Peru, does not speak any kind of dialect of Spanish that we were able to converse with her. So when the daughter came up, she calmed a lot. She just needed someone to tell her what was going on, why she was here, calm down. Worked her way eventually up through the ICU, but I'm extremely pleased to report that she went home last night by ambulance. She arrived at home about 9 o'clock. She lives about 4 blocks from Teresa Cooper, so Teresa went over and gave her a pulse ox. They were concerned, her daughter was very concerned that her oxygen level would drop down. Did they need to bring oxygen? They arranged to have a bed delivered and all the DME that she needed. Truly, this is one of those village things where it was a lot of people coming together to make that happen. Teresa was able to report this morning that she was settled in, she was home, feisty as ever, but I think that's probably what got her through this whole encounter. And so again, just good work on everyone's part. They recognized that she needed her daughter there. We were able to make that happen. She was able to Zoom her. The daughter only came in once, but they were able to keep that contact going to calm her down. And it's everything that could have happened right, happened right. And that's a 100-year-old person. That in itself is phenomenal, but to survive COVID at 100 years old is incredible. So that's an amazing story, but it wouldn't have happened without everybody's engagement and everybody working collaboratively. So thank you to everyone that participated in this person's care.
Woo-hoo, that's great.
Okay. Dr. Baden, are we seeing improved accuracy in the COVID-19 testing that are currently being utilized?
So we've always had, we've always been fairly confident about the sensitivity of our RT-PCR testing, meaning its ability to accurately detect a positive case, and that continues. We are also using the rapid test primarily in our emergency room. And I will tell you, we knew at the outset that this test was not as sensitive, meaning that we couldn't rely on a negative test to rule out COVID-19. And we've continued to see that in our data as well. So we are using that test, but we're pairing it with the more sensitive RT-PCR to get a better handle and to provide more accuracy. It's useful because if positive, we can usually rely on it to be a true positive and allows us to make the diagnosis earlier than the RT-PCR, which takes about 36 or so hours to come back still. And the RT-PCR and the rapid test, which we're doing, takes about an hour. And so when positive, it is reliable. When negative, it could still mean it's a false negative. So we do back it up with an RT-PCR when we have a suspicion of COVID. We don't want to be using that rapid test to screen for COVID in asymptomatic people, for instance, because it's not reliable when negative. It's only based on our preliminary internal data about 82% sensitive. So that means about 18% of the time we may be missing a diagnosis just relying on that test alone.
Great. Thank you. Let me see. So, Delvecchio, I just wanted to share with you commentary in a recent letter that you sent out. This particular individual really wants to thank you for the letter that you sent. It inspired so much deep pride in this organization and excitement about having the privilege of working here to serve our community. So many of us deeply value and appreciate your insightfulness, compassion, and leadership. Also, these meetings have been immeasurably helpful and inspiring, and it's been lovely to get to know you a little better through the video meetings. Thank you. So just wanted to share that with you, sir.
Thank you. The feeling's mutual. I have an incredible sense of honor and pride in working alongside all of you, and sometimes words escape all of us in situations like this. So it took me a while to try to capture it, and I'm sure it continues to evolve. But a lot of that was really channeling what I heard from all of you, and really wanted to make sure that we gave voice to that in a way that hopefully honored what we're all going through, and we'll continue to go through together, all in the vein of getting to a better place for each other and for our community. So thank you. And I should probably tell people my facial expressions are notoriously problematic. So hopefully you're not just getting to know me virtually. So I can make up for it in person, but my facial expressions are a little bit off. So sorry.
He's just intently listening is what he's doing. It's good. So, as we have conversations around, recent topics, racism, discrimination, police misconduct, and the like, there are a lot of conversations that are being had, and we're all coming at these things from different perspectives. I think a question that's been posed is, if we're hearing something from someone that may appear to be misaligned or may raise some other issues, how might we address each other when we're having those kinds of conversations? And I'll share a little bit of an example. As you know, the Black Lives Matters movement initiated early on, and then there were some folks who decided that all lives matter, and many folks took that as maybe a counter to the Black Lives Matter movement. So there's a question about when we hear something like that, or somebody uses that phrase in a particular context, how might they just continue to dialogue about what that means and how they may be viewing that when it's heard? So I'll just put that out there I have some thoughts. I'll let others speak, but I'll speak at the end. But would anybody like to weigh in on how we can manage these really important and sensitive, but also critical conversations?
So Terry, I'll take a stab at that first, if I may, and then it can only be my own perspective. I think having read Delvecchio's letter, talked to him, read much more about this, watched too many videos, I would hope that if someone posts something, be it on social media or say something that doesn't align, that our employees feel safe to go and speak to that person. The only way you get mutual understanding is to listen. You get less from talking and more from listening. And I think if someone says something that offends you or you don't understand, I would approach it first with good intent that the person doesn't understand or made an error. and to let them know how that post or comment actually made you feel, how it made you feel in yourself, how it valued you as a person, how it valued you and your race, and that that person understands that you want to have a conversation about it. And I think that is the best jumping off point that I could advise people on. And that if someone comes to you and tells you that you have posted something or said something that is offensive to them, that you hear them, that you understand that they're trying to express their own emotion and feeling about something, regardless of what your intent in the posting was. People say things inadvertently all the time because they don't understand your life, where you are, your experiences. If you can have a little bit of empathy and understand that they may have made a mistake yourself and listen to what they share with you, then it's a good starting point. It's certainly not an ending point, but it's a place that we can start to have a conversation and understand each other in a way that gives us some hope of moving something forward, as opposed to digging into positions. Because when you do that, then, or approach someone in a way that you're clear they did something wrong, and that they need to change, often people dig in, even if they don't intend to. It can have a visceral reaction that prevents a conversation. It doesn't mean that what they did was right. It doesn't mean how they express themselves is necessarily acceptable. But if we start with a conversation, then we have a chance. And if you're not comfortable with that, I think reach out to someone else who can help you facilitate that, whether that's someone in HR, a colleague, another manager, because if you're worried about it and therefore you don't have the conversation, we're not going to move forward. We've got to start with somewhere, and that's got to be a conversation. So I'll stop there and let anyone else jump in.
Thanks, Tony. I think that was so well said. I think starting with the spirit of curiosity and inquiry in order to find common ground is so important. And I oftentimes approach conversations like this with a rubric that I use, which is observation. I've observed something. It makes me feel a certain way. Observation, feeling, and then end with a request. Like I request either to have further dialogue about this or whatever the request might be. But I'm so glad that we're having these discussions. And I agree, I was equally inspired by the message sent out from Del Vecchio yesterday.
Yeah, I won't have. Thank you, Tony and Felicia. Not much more to add to that. I think one of the important things for a community like ours that is so diverse, and an organization like ours that is diverse, is that that it offers an incredible opportunity to celebrate that diversity by seeking to understand it, to appreciate it in its beauty, because there's so much that's wonderful and unique and incredible about people's journeys and their walks in life. And also sometimes it's a little bit unsettling because people's worldviews or experiences may so vastly depart from yours that it may be either jarring or, again, unsettling for you. But I think you stated it the right way. We shouldn't assume anything from anyone, even if it aligns with perhaps, I think you stated it nicely, Terry, a pronouncement of what someone else may have kind of done to a message or done to a word even, that we should actually seek to explore that. And I'll just share a really quick example. Our electronic health record, we call Sapphire, and it stands for, no one will ever remember this, System-Wide Access Promoting Population Health, Resilience, what else? No, I'm sorry, Integration, Resilience, and Equity. Everything we stand for. We were really proud of that because it had a lot of things that worked. But right away, we learned that there was a subset of our community, particularly African Americans, and particularly people of either a different generation or a different walk, who associated Sapphire and the name Sapphire to a historical popular culture context that wasn't particularly flattering. and it offered an opportunity to be educated about it, to really figure out if that word was triggering to people in a way that certainly wasn't the intention of the organization, certainly wasn't mine. Even I got educated on something I didn't even know about. And through that, promoted some really rich dialogue that went to the people who thankfully raised it and said, be careful about this. And actually, it initially was take this down to let's understand what's behind that. And there was a lot more concern about not just that potential miss message, but what belied it in terms of people's concerns about what we were doing within the organization in terms of how people of color are treated in a clinical setting, some senses of, and not just, as to say, in non-clinical settings as well, and senses about what that said about us as an organization. And through that very rich dialogue that I thank Terry for leading, and for those members of our organization for raising, we got to a point where people were comfortable. They understood that that wasn't absolutely anything we intended, and that wasn't necessarily going to be a byproduct of it. We had a chance to reclaim a word that had multiple meanings, but take away some of those negative connotations and association by lifting it up and really explaining what we meant by it, which was something diametrically opposed to it. So I think conversation is critical. Seeking to understand is critical, and to educate and help us move along. And at the end of the day, we all grow and we get better from that. And if there truly is a problem beyond that, I think we should actually recognize and remind people that there are mechanisms for bringing those forwards where other people can get involved in those discussions or those situations as well. But I absolutely support the notion of have a conversation, raise it, because if you've been inadvertently offended, I don't want you to sit with that. I don't want you to let that fester. I want you to bring it up and let's have a conversation about it and see if we can move to a healthier place together. So I said I didn't have much to offer, but I was triggered a little bit. So thank you for the question.
No, and the only thing I would add is that the enormous, I think, outpouring, just to me personally in my life, of people who want to help and understand, what is happening has just been really tremendous, and it's been heartwarming. And folks are very concerned. They're very concerned that if in trying to help, they become part of the problem versus the solution. And what I've said to them and others is, I think it's important that we understand the intent of people's involvement and wanting to help. And that doesn't mean that they have all the answers or are going to say everything the right way. But if we can open up our hearts to appreciate what they're attempting to do and help people feel comfortable and offering and trying to lean in and understand better from different people's perspective of what's going on, then I think this effort to address these issues will prove much more successful. I think we have to figure out how to be advocates, allies, and I think Black lives do matter, and they matter in a way that really reflects, the disparities that have existed for a long time. Changing those things and those systematic issues that we talk about social determinants of health here at Alameda Health System. These are things that we all have to rally around to address and fix. And we have to have a collective solution to these problems. So we have to engage everybody in the conversation. So,
sorry, for us and most important for the people who come to us, because sometimes we don't get to have that conversation with them. So that's why it's so important that we reflect the diversity of our community in our organization, because we need to make sure that me saying Black Lives Matter may have triggered some people in our community. I needed to say it just as you just said it, Terry, because I need to underscore that in this moment, more so than any other moment, that the systemic racism and prejudice that is disproportionately impacting communities of color, whether it's isolated incidents or the magnitude of the incident, warrant saying it, warrant making sure that I affirm it. And that's the reason why we have diversity in our leadership. That's the reason why we have diversity in other parts of the organization. Doesn't mean that any of us will always get it right. Some people will like what you say, some people won't like what you say. But we have the opportunity through having a diverse organization to make sure that somebody is speaking to all parts of our organization and that we're speaking to each other, irrespective of how we present and how we look. And I think that's that's the beauty of all of this. I'll just share one other confession. I remember being mortified one day. I went to my car and spoke to an employee who I've spoken to several times, and just in my be honest, I'm saying this because it's Pride Month, and I think being open is also really, really important. I mistakenly to this employee said, you know, how are you doing, sir? And I think it was a contractor working with us, and she said, I'm not a sir. And I, I was knocked back on my heels because of my embarrassment and because of my assumption. For someone I'd spoken to for several times and probably never got gender correct or acknowledged gender, but in a moment that I did, I got it wrong, and I apologized profusely and had to correct myself and think about how do I do that. And fortunately, this person gave me the opportunity to redress that. Somebody else may not have. Somebody else may have been truly offended and taking it to a whole nother level. But she honored me by giving me that opportunity to say, you got it wrong. And I know you weren't, you know, ill-meaning in your message. We talked enough that, you know, I just need to correct you here. And I appreciate the gift of that. And it's made me mindful of it for not just employees, but also patients. And I'm sure I've probably gotten it wrong other times since, but I keep trying to remind myself. And I think we should just take those opportunities to know that none of us are always right, and we will get things wrong. We will offend people unintentionally, and we just need to take those opportunities to help and be helped. So thanks again.
So Vecchi, I wanted to maybe give you an opportunity. I know we've talked about this and was mentioned in your message. A lot of this really speaks directly to the health equity, diversity, and inclusion work that the organization is undertaking. Maybe you can share a little bit about where we are in that process and how we might be utilizing that as a means to speak to some of these issues.
Yeah, thank you, Terry. I'll start with a really a deep appreciation for all the various members of the organization who have stepped up to participate in that effort. There are a lot of people who have, actually more people than we could accommodate, who expressed great interest in participating in it, whether they were interested in exclusively or predominantly either the health equity or the diversity and inclusion. I mean, they cross both lines. Health equity is not just about the equity and health of the people we serve and the community that we serve. It's obviously health equity for our workforce as well. And diversity and inclusion, same thing. And so there have been some amazing leaders, clinical and non-clinical, who've really taken up that mantra. They're working in 5 different domains of sort of best practice guidance for organizations who want to grow and accelerate their efforts and their proficiency in advancing these efforts, and basically doing a deep assessment of where we are. Some things we're doing pretty good at, some things fairly good, some things not good at all. And this group is taking a second stab at a first stab that was kind of a across the board assessment and saying, you know, can we inform this more? And some of the rankings are going up, some are going down, and we expect that to happen. The byproduct of that, or I should say the outcome of that will be 2 things. One will be what we're calling a dashboard of recommended activities that the organization will take to further our progress along these dimensions of health equity and diversity and inclusion, that we'll then take to our board and then activate basically off of the recommendations of these groups. The second thing is a report card where we will continue to look at this, because some things will improve, some things unfortunately may go in an opposite direction, or the ranking and the prioritization of what the group comes up with will evolve over time. We'll get more and more people involved in the direct work, not just the actual activities, but the planning efforts over time as well. So we want to make this a living, continuous part of who we are, just as much as we are continuing and trying to strengthen our efforts in patient experience and in quality and patient safety as an organization. Health equity, diversity, and inclusion, right along those lines. So more to come on that really soon. The group kept their work going even through the pandemic, which was wonderful, and we're just reinvigorating it now as a collective and making sure that the group can successfully bring that to a nice set of recommendations that we can move forward with in the coming months here. So more to come on that, and perhaps we can, I didn't say this earlier, but I think this dialogue is just the start of more dialogues that we will have. And I will either use this forum or another one to, a focus one to actually bring some voices in to help us to have this conversation and to continue it as an organization.
Right.
Yep.
Great. We are approaching the hour. I will say that the conversation that we've just been having has been very much appreciated, both by myself, but also from folks who've been listening in and the comments they've been sending forward. So, as Vecchio said, this is the start of that dialogue, not the end. So we look forward to having those conversations moving forward. So, Del Vecchio, as always, I'd like to give you the last word before we depart, and take it away.
You're on mute.
Thank you. I'm sorry. As I always do, I want to start by thanking my co-panelists. Dr. Turner-Bennett is getting a reputation for breaking news, so I want to thank you for that. But all of you, I learned so much when you respond to these questions about what's happening with COVID-19, what's happening with some of our responses, things we're doing to support our workforce, and things that, quite frankly, we're challenged and struggling with. And I appreciate the candor. I appreciate the forthrightness that we are approaching this. And I also want to thank all of you. Your participation in these conversations spur us forward. You bring forward great ideas. You bring forward great questions, and you share too where you're struggling, and that is, I think we're all better for it. So thank you for your continued engagement. Thank you for your continued participation in these conversations. So as we end today's chat, I want to reflect on our commitment to serving our communities. It goes without saying, but it should be said. Our communities are hurting, and we hurt along with them. For those of you in the organization, I hope this doesn't sound cliche. It certainly is not meant to be. Our employee assistance program is available to you by phone, by email, and are prepared to support you as best we can should you need that, and you should not shy away from using it if you do. Please remember to check out our Wellness Wednesday messages that talk about stress relief, that promote laughter and other forms of just self-care and wellness. The other important thing when you're thinking about self-care and wellness is staying informed. Information is power. And if you haven't done so already, I just invite you to consider signing up for something called Nixle Alerts. That's Nixle. These are alerts that are provided publicly. You can receive up-to-date information from your local public safety department about things that are of good understanding or good pieces of information for you to know whether there are road closures or heightened activities that might impact your commute or your neighborhood and or what's happening around you. So consider signing up for those alerts as we want to enhance our own ability to communicate with you internally, but also for you to have awareness on a broader basis. As I wrap up, I'll just say thank you again. I encourage everybody to take care of yourselves, take care of one another, stay safe, stay strong, and we'll see you next week. Thank you, Terry.
Thank you, Del Vecchio. Just remind everyone that this chat will be posted on the intranet for review and for sharing for those who were not able to make the call live. So thank you again, and we'll see you next week.